My name is Donald, and I'm a registered nurse. I graduated from Northern Illinois University about 7 years ago, precisely 2011. And right after my graduation, I started working from a nursing home. I almost spent a year there before I started working in the hospital, primarily in the ER. So I'm an ER registered nurse. Working in the ER has given me the opportunity to um, treat or deal with all kind of patients from different lifespan, from infancy to old age. And also, while working in the ER, I've become a charge nurse, which has given me a leadership opportunity to be able to, manage my peers and also the affairs of the ER, you know, care. And I've worked at different hospitals in the Chicago area, and now I'm an agency nurse, which kind of give me a leverage to kind of travel to different hospitals and understand a different health system. And and I've also worked in different nursing departments, namely telemetry, medical surgical, ICU, and mental health, and also detox. And this has given me an added advantage to know about admission process, how to admit a patient to the hospital, while also dealing with them from the ER. I kind of follow them to ICU and also telemetry or medical surgical or whatever it's supposed to be. I've had the opportunity to deal with doctors, have rapport with them, advocate for my patient, you know. And talking about evidence-based practice, I've utilized this many times, and I use it pretty much on a daily basis, especially when I'm giving medication to my patient. I've researched on my own, and I've come up with a proof and a fact that it is better to give medication on a timely fashion, especially when patient present with symptoms of pain. They may have different symptoms of pain, and the best way to attack it is to advocate for this patient as soon as possible so that it will not create any further anxiety. Because if they are in pain and they are groaning and screaming and yelling, the only way to reduce it or to kind of stop it or prevent it from happening is by advocating as early as possible for the through the doctor, and also when the medication is ordered, you can give it as early as possible. You know, also I've used or utilized evidence-based practice in my capacity as a charge nurse. Sometimes I work in a community hospital where the nurse to patient ratio is 5 to 1. In comparison to other hospitals that I've worked at that are well structured, it's like the nurse to patient ratio is 1 to 3. So I have this one nurse that used to come to work late. And I kind of did my research and I found out that when nurses are late to work habitually, it's either because they are dissatisfied with their job. So that kind of give me opportunity as a leader, a charge nurse, to kind of talk to my manager about reason why what will motivate a nurse to come to work early is because sometimes the working environment is not friendly to them. I mean, a situation where you work in one ER and the nurse ratio is 1 to 3, and you work in a different ER and the nurse to patient ratio is 1 to 5, and you're getting paid the same amount, and not to even talk about the workload, wherein some ER are very busy and very crazy. So this has utilizing the evidence base kind of helped me to find out about that. And also evidence based practice, I also utilize it through preventative care, which has really inspired me to open up or establish my own YouTube channel like healthcare, health alert, blood pressure, talking about blood pressure and diabetes. Sometimes working in the ER has given me the opportunity to learn from different demographic or population of patient, wherein when they come into ER, they come in, they don't have any clue. Clear example would be a patient that came to the ER for headache, And the reason why he had a headache was because his blood pressure was up. And he had no clue about what blood pressure is all about. Because when I asked him, do you have any history of blood pressure or hypertension? He said no. And I kind of replied to him and said, the fact that you have been diagnosed with the fact that you have not been diagnosed with high blood pressure doesn't mean you don't have it. So many people come to ER, they don't have any clue, they don't have any idea about their own health. Sometimes some people live a carefree life or a careless life about their health. So this has inspired me to kind of open up in my own YouTube channel, like I said, to talk about it. Because sometimes it is better to prevent than to cure. And if the public is more aware or they are educated or informed about healthy living, it will go a long way to kind of change their attitude and their perspective about taking care of their own health. So what I want to do, or area that I want to focus about, um, given my experience in different areas of nursing, I want to be a primary care provider, even though it may seem like I've garnered these experiences from different nursing departments. Sometimes will make me a jack of all trade and a master of none, but at least it will help me to be able to take care of my patient the right way. I'll be able to know the kind of diagnostic test to order before embarking on the appropriate intervention or treatment. So I want to use that as an opportunity to be a primary care provider. Will kind of give me the opportunity to be able to, take care of the patient, and also having opportunity to open my own clinic, and in the long run, I'll be able to reach back to the community by organizing a free seminar, organizing free health fair wherein they'll be able to come. It's just a way of public awareness and sensitization about healthy living and health, how why it is important. If you are talking about longevity, you cannot talk about that without equating how you live your life and living your life in a healthy way. So the health fair will kind of give the platform to be able to do that. And that would just be a way for me to give back to the community, who has given me the opportunity to take care of the patient. Um, Personally, or personal item to talk about, I've been married to my wife for 21 years, and I have 4 kids, 2 boys and 2 girls. The oldest being almost 20 years old, and she's in college right now. I was born in Sierra Leone, and I have an heritage in Nigeria. Um, I want to say before I say goodbye, I wish everyone good luck, and let's get it started. All right, bye to everyone.